It is Health Diary. My name is Gladys Gashanja and we're coming to you from the Park Inn by Radisson here in Westlands. Now, one of the most associated mental health conditions with death by suicide is bipolar disorder. Now, those who live with this condition have to deal with erratic mood swings, which are not easily understood by those around them, leaving them feeling helpless. Now, the good news is if they get proper diagnosis and timely treatment, those living with bipolar disorder can live a fruitful and fulfilling life. So today we talk more about this condition and see how much more we can do to support them in this journey. Before we get to it, here now is a fact of the matter. Bipolar is a mental health condition that causes extreme mood swings that include emotional highs, mania, and lows, depression. Manic episodes may include symptoms such as high energy, reduced need for sleep, and loss of touch with reality. Depressive episodes are often characterized by low energy, low motivation, and loss of interest in daily activities. Treatment for bipolar is lifelong and often involves a combination of medications and psychotherapy. And helping us along with this conversation, Dr. Chitayi and, of course, Honorable Rachel Shebesh, who is living with bipolar disorder. And speaking of which, we touched on the stigma it comes with. And this stigma costs those living with bipolar disorder a lot of things. Rachel, what have you lost?
Oh, I've lost a lot. I wouldn't even know where to start. I like the way you keep saying when you're introducing me is that I'm living with bipolar. People feel that you must be treated and you must be healed. And there must be a point at which you say, I don't have bipolar disorder anymore. Bipolar disorder is part of your life for good. But can I tell you that I've been in leadership for long enough to know that all diseases, not only mental health issues, have a stigma-related story. Take COVID, for example. Who wants to accept they have COVID? And we all know COVID is all over the place. People are hiding that they've gotten COVID. When HIV came, stigma was the biggest thing. Today, nobody talks about HIV. If you have HIV, you have HIV, and you continue with life. I have bipolar disorder, but now my life is not controlled by my bipolar disorder. However, I have to go out of my own way for the sake of my own sanity to explain to people. I explained even to my president. My president and I have had a mental health discussion and my process of bipolar and depression. If I don't do it, how do I work for him? How does he understand my capacity and then my seeming different, what can I say? Erratic behavior. And even when we talked about this mental health task force that was set up, I guess I am one of the few people who can say, thank God that I have the capacity to reach the president and leaderships because, and that's why I'm using this piece. I don't have to have committed suicide for you to know that my bipolar reached a point where I couldn't deal with it. We are walking zombies. We are walking problems with somebody you are working with who does not want to accept what it is they are seeing in you. Again, I'm repeating, if it was not for my husband, I probably would have taken either longer. You never know how far I would have gone with my bipolar. And now my support system includes anybody who knows me, including my office staff.
So let's go back to what it has cost you. You keep talking about the husband being a very great support system. Do you mean you've lost friends?
Oh, of course. Of course. And I don't blame them. I lost them because I had bipolar and I was too erratic for them. In about 2 months, I don't talk to you, I've blocked you and I don't pick your calls. What would you do? You'd say, oh, she's a pretender.
She ghosted
Oh,
me.
this one is, yeah.
Yeah.
Ghosting is one of the biggest things that bipolars do. We are good ghosters. We disappear from you. Yet we are spending, again on the other spectrum, every single day we can talk 6 times. You lose your reputation. Oh, reputation is big with bipolar. Because when you're manic, you are manic. And mania is so much fun. Because when you're manic, you have the greatest ideas. You don't sleep. You can scribble the whole night. Now that I have skills, instead of scribbling my many things, I journal. That I was taught by my psychotherapist. Because it won't go away. So now I journal a lot. But before, oh, I'm writing furiously, I have an idea. And tomorrow I'm going to call the president and tell him, this is the problem and this is the answer. And it must be that answer. And I'm very clever, I have said it, really. But then, on the other side, when you get depressed, and that is my biggest fear of bipolar. In fact, my whole reasoning for speaking out on bipolar is the depressive state. For 1.5 years, Kenyans didn't see me. My depressive state of 1.5 years contributed immensely to me losing my seat. Funnily enough, Esther Passaris, who took my seat, we are very good friends, and we talk about mental health together with her. She's actually one of my support pillars. Passaris is one of my support pillars on my mental health issues. But I always wonder how to describe depression to somebody who has not gone through depression, so that you understand that when you wake up in the morning, every single day when I wake up and my heart is free and I take a breath, I always say, thank you, God. Because in depression, when you wake up, you have a heavy sadness, like a heavy blanket on you, and you do not want to wake up. I did not leave my bed for months. For months. And I mean, you have children, you have parents. They come into your room, they look at you, they leave. They come the next day, they pray, they do everything. They come, they leave. You can't get out. You try your best and you can't get out. You are even feeling sad about how sad you're making people around you, but you have absolutely no power over it. I fear the depressive state more than the manic state, because the depressive state then leads to the suicidal thoughts.
Dr. Chitayi, what more can be done to help, equip the patient support system? Because clearly, as Mheshimiwa is saying, she wishes people understood how the shoe pinches.
Listening to Mheshimiwa giving her story about, about the two extremes. I've also had some conversations with my patients who say that they actually sort of enjoy the manic state. And so I totally identify and how bad then the depression is, It's almost like the opposite. It's almost like your mind tells you that a nice time to punish yourself for this. So I totally understand. And of course, there are many gaps within our country in terms of persons suffering from these mental illnesses, but also the caregivers, being equipped to be able to do the task of living with the individual and supporting them. The Mental Health Task Force actually has made some good recommendations, and I'm happy Mheshimiwa was part of the team perhaps that sort of pushed, from where we sat, we did not know how the president got a lot of information about mental health and took a bit of interest in it and even spoke about it on national days, about the importance of mental health, and went ahead from the Mental Health Task Force, which has made some great recommendations and which I hope that they'll be implemented. One of them being that we should increase whatever amount of money we allocate, the budget we allocate to mental health, both at the national and the county governments, so that our hospitals are equipped properly. We have the right staffing. You don't just need medication, you also need psychologists. So we need psychologists in our hospitals, social workers, occupational therapists, and all related workers to be in our hospitals. Then when it comes to medication, we also need, mental health itself is an applied science. So where science keeps changing. So the medication that was used in the 1950s, if you use it now, you tend to get a lot of side effects. You'll be shaking, you'll be totally having, problems, even talking. Sometimes you may have excessive appetite, you may have issues of maybe sleeping too much, but there are newer medication based on research that we can equip our hospitals with. So just putting more investment in mental health, that is going to help, but also being able to empower people so that they can access. So we can have good hospitals. For example, we can say, okay, there are hospitals like Karen Nairobi Hospital, Chiromolen, Oasis, which offer Avenue Hospital, which offer private mental health care. But how many Kenyans can afford to go there and pay out of pocket? Well, probably myself, I can't even afford, as a psychiatrist, to access psychiatric services in a private hospital in Nairobi if I'm to pay out of pocket. And so we must also provide, a financing system that allows people, whether it be NHIF, we make it possible for people to access services. NHIF itself is very good in terms of the act, that says nobody will be discriminated. But when it comes to mental health, actually NHIF discriminates against persons even who are suffering from substance use. If you are to be rehabilitated through NHIF, they'll only pay like half of your fee. The remaining is very high, and so families are still unable to pay for mental health services. But again, just on law alone, the Mental Health Task Force also made recommendations about laws that must be changed, including the Decriminalization Penal Code 226, Section 226, that makes suicide attempt a misdemeanor. We must change these laws so that people understand that mental health is like any other disease. Any law that seems to be discriminating persons living with mental illness increases stigma, and therefore such laws should be changed.
Let's take a short break, and when we come back, more on bipolar disorder. Thank you for staying with Health Diary. My name is Gladys Gashanja. Today the conversation, bipolar disorder, still joined by Dr. Boniface Chitayi, who is a consultant psychiatrist, and of course Honorable Rachel Shebesh, who is the CAS at the Youth and Gender Affairs Ministry. Now, let me take you a little bit back. On a personal level, those living with bipolar disorder living amongst the community, how can we equip this community to support those living with this disorder?
Yeah. I think our communities, there's an information gap. We do not have sufficient information within our communities when it comes to mental health. So you could start from homes, but then extend to institutions like schools, universities. This recommendation that has been made by even professionals, including the task force, that we should have mental health as part of our curriculum. And we should have counseling services being part of even the timetable, the way physical education is. Why do our children engage in physical education? To be healthy physically. But what do we do to make them healthy mentally? Nothing, right? And then influential organizations within the community, like the church, whether if you are a Muslim, we can organize also information around these groups. Is it possible, that even leaders of these organizations include mental health in their training and so on? Yeah, that will really create a difference. Then you can extend this community to include even a criminal justice system. It's part of our community. So either it's part of government, but also part of community. Is it possible? Because a lot of times, also mental illnesses, you know, can make somebody behave in a way that people feel it's offensive within the community. And lastly, and touching on you, is the media. Yeah, in your profession. The media plays such an important role in educating the community. If you ask Kenyans, their knowledge around any issue most likely is shaped by what they've seen in the media. So media coverage of mental illness needs to change, and maybe media practitioners need to be more empowered with more knowledge about how to cover even issues of suicide. You know, we've talked about suicide and homicide. Somebody dies, or an incident happens where there is a homicide, but then in the following weeks, you find that so many of such are now happening. And what is the reason? It's because of how it was covered. So covering, there should be some guidelines. One of them being that in cases of suicide, for example, that should never be a headline. Yeah, within, whether it's a newspaper or electronic media, the story should not be repeated. A story of suicide should never be repeated. And number 3, details should not be given about where the person was, even their profession. Try to omit details that can lead to other people thinking more about suicide in the same situation. And then commonly, and I see this a lot, we publish even suicide notes in the media. So the moment you publish suicide notes, again, you are encouraging a copycat. And lastly, anytime we cover issues of mental illness in the media, we must give additional information on where people can get help.
Mm-hmm. All right. And in the Dr. Chitayi has mentioned the cost of treatment. This is a chronic illness. Many people lose the battle to bipolar disorder because they cannot afford the treatment. You are privileged to be a legislator. How about those who cannot? How can we help them?
You will find that people can go to a health center today, be treated almost free, go with their mental health. There is no discussion even that it can be free. And the medicine is so expensive that even if you started off with it, you will eventually stop taking medication because of the cost. So that's one, totally. And I'm hoping that the mental health task force that was put together, one of the things that must be the recommendation is that mental health must be carried by NHIF. I mean, it makes no sense. I mean, there are things which are just too clear. We don't have to second guess too many things. There are some things that are so clear that can impact mental health now. And one of them is the cost of treatment and the availability even of that treatment. Because we may be lucky in Nairobi that now we have psychiatrists around Nairobi, psychotherapists. But I wish we were there all over the country. If you go to Mandela, can you get a psychiatrist? Or yeah, are you getting me? So government, do something about that, if you're serious about that. But I just wanted to say in our ministry, because I work in public service, I just want to tell you the numbers you see through the media, because we're talking about the media, is a tip of the iceberg of the reality. Our ministry, through my CS, Professor Moget Kobia, who I deputize, again, because as I told you, I talk about it. We have taken up mental health in public service because we are in charge of public service. How many times do you do stories about a policeman who has shot his family and shot himself? That's a civil servant, isn't it? How many times do you do stories of people who jump off Nyayo House or whatever? The moment you do that story, please do times like 100 of the reality. So what we did in our ministry, we created a mental health department, and we have recruited counselors. And through our ministries and our departments and everything, we have spread the message. We have free counseling services now for civil servants because it is our responsibility. So just also to say, please, cyberbullying is real. This story and speaking to you is going to get me more negative comments than positive. Do you know that? It's like a guarantee. I am telling you. It's like a guarantee. And there's a time that would have knocked me off totally. Now, I am so well skilled with my triggers and how to deal with my emotions that I have the confidence to sit here and speak, and I will continue speaking, irrespective of whether tomorrow, somewhere in a newspaper, the story will be Shebesh accepts that she has a mental health disorder, therefore she wanted to commit suicide. I don't know when, which I have not said. But because the story that will sell is not that Shebesh is trying to talk to people about the mental health and the stigma, what sells is Shebesh is done. Pick that up in social media. Everything related to my life now is going to be taken to, oh, no wonder, she's crazy anyway. We've always said, oh, mama, cheesy. Are you understanding? So I am ready for that, but not everybody is ready for that. So media, cyberbullying, etc., must be held accountable also if it is about holding people accountable. I agree 100% with the doctor when he says media can play the most critical role in helping us deal with mental health.
All right, even as we wrap this up, definitely there is strength in numbers. And the more we have those living with the disorder talk about it, the more strength they give to others. I don't know how many support groups are out there. Are you part of one?
I am a support group proponent, very big one. Because it can't be easier for somebody with bipolar to call me today after seeing this program than to call the doctor here. Yes, just feeling like, let me hear it again from Shebesh. You feel this thing I feel? Yes. You do this thing I do? Yeah. Instead of the number scrolling for the doctor, it is my number they will be asking for. So again, when you're in mental health issues, just like even when you're in addiction, a support system around you is your saving grace. So there are many support groups, very many of them. But how do we get people to get into these support groups? People like me must speak. Parents who have gone through the pain of a child who has probably gone through mental health and committed suicide. When our children learn that even if I can't go to my parents, I can go to my auntie, I can go to my pastor, I can go to what? We have already started carrying the burden of this mental health issue. So please, let everybody support anybody they think. And don't be shy. There is no language that is right or wrong. Even just asking somebody, are you okay? You would be shocked how that question, are you okay? Nobody has asked somebody who for 2 years, 3 years in the same office, you know there's something wrong with this person. And nobody has ever asked this simple question, are you okay? Please let's ask each other how we are.
Very well said, Dr. Chitayi. Please speak into this. We have the reality of mental illness, as Mheshimiwa has talked about. But the beauty of it is that there is a life after diagnosis and with the proper treatment. Speak about this.
Many people with mental illnesses actually do recover. Some to the extent that they actually stop taking medication. Yeah, and while there's a number that could continue taking medication and still be well, but they can be healing, but they can also be recovery. They can be, people can go back to work. The attitude that somebody diagnosed with a mental illness will be always unwell, yeah, is outdated. It's a myth. Yeah, so people actually do recover, and so if you have a workmate, a student in school who has suffered a mental illness, they can receive treatment. Let them come back to school. Welcome them back to school. Welcome your colleague back to work. And our institutions must accept them, and our communities must accept people back into the community.
Mm-hmm. All right, very well said, Dr. Boniface Chitayi, consultant psychiatrist, and of course, Honorable Rachel Shebesh, who is the CAS, Ministry of Public Service, Youth and Gender Affairs, who is also living with bipolar. Thank you for being so candid and being such an inspiration and light for many that walk in your shoes. All right, at that point, we take a short break, but here now is a health tip.
A tip on boosting good mental health is to surround yourself with good people. Having a support system of family and friends who are good people and give you good advice is very important. That helps you feel good about yourself and make sure that you are living your best life. So see the people in your life that support you and make you feel good as often as you can, whether it's family or friends or just people who are close to you.
Thank you so much for engaging with us, even as we learned more about bipolar disorder and heard from those who live with this reality. Of course, if you would like to reach the Honorable Shebesh for any of your questions and support, as she said, she is available and you can reach her on her social media platforms. And from us here at Health Diary, my name is Gladys Gashanja, and today we've been coming to you from the Parking by Radisson here in Westlands. See you. Have to live with erratic mood swings. Okay. Now, if there's one condition that is highly Chitayi kitu haki. Or comments, you can also